Hi. So, after the first lecture, which discussed basics of clinical history recording, especially when you are talking telemedicine, it is time for us to do what we are supposed to do and take these things in a step by step manner. So, in that order, today I will pick up a second aspect of analyzing things, and when I do so, I will be touching on two basic points. One of them is how do you link or map things that happen, the events that happen as told in clinical history, onto the anatomical aspects of their description. And second, usually what happens is we as Ayurvedic doctors don't get first incidence cases, rather cases that are already diagnosed. So when you get pre-diagnosed cases, you have a plethora of reports, sometimes few, guided by modern medicine investigations and their pathology and their screening or scanning systems. Therefore, how to interpret them onto this anatomical design of Ayurveda is significant when you have to arrive at a diagnosis, number one. It is also significant because it helps you understand what flow the pathology has taken, the track it has followed, and how it looks to develop. Let me first talk about the anatomical design. Now, broadly speaking, the anatomical design is actually the same as modern medicine if you refer to textbooks that we have studied. However, certain elements in case of Ayurveda are different and they seem to be more detailed compared to modern medicine. Take for example the description of 7 layers of skin. Modern medicine doesn't really go beyond 2 layers of epidermis and dermis, and therefore after they have those subsets, not exactly tissue level differentiation to say that these are different layers, but yes, components of the skin tissue. However, in the Ayurvedic context, there are 7 layers right from inside to outside, and these 7 layers are defined as per their function. Definitions of anatomical structures in Ayurveda are both in places structural, in places functional. That is to say, in places they are physiological and in places they are actually anatomical. The anatomy or the anatomical design in Ayurveda is not discussed the modern way today, where modern science sometimes discusses its anatomy in terms of biochemistry or in terms of cellular designs, but it's a very broad thing, not considering a single cell or considering a tissue or a whole macro body, but those concepts extrapolate, or those concepts can be narrowed down in either ways you want to consider, to a cell or tissue level as to a macro human body. An integral element of this anatomy is Srothas. The Srothas concept is something that differentiates modern medicine from Ayurvedic medicine at a larger organ structure level, both functionally and the interrelative functioning of the different systems that modern medicine talks of. Now, Srothas by itself means a source, and a source being of importance in anatomical design when it comes to clinical history taking is significant. The significance of this lies in the history that you record. Reason or to understand this is important because when you have a clinical condition and a patient has given you a study, say for example he reports that it started with burning sensations in my urine when I would pass urine. Both modern medicine and Ayurvedic medicine will pick this up as a disease of the urinary system, Mutra Srothas. Then there could be some other things that have developed. Say a condition like nephrotic syndrome develops and the person presents with a lot of edema. This edema on the face, on the feet, on the body, generalized anasarca, it embodies a fact that the body is losing something through the urine in terms of albumin. That is how modern medicine reads it. And as a result of it, there is a capillary level filtration of molecules that just go down along an anionic gradient that goes down, and it keeps coming in a way that water is retained within the body, and there is a change in the hemodynamics. I'm not getting into the details of it right now. This represents an involvement of modern medicine, if you say, the beyond the renal system, it is into the blood capillary system. In the Ayurvedic context, this has a slightly different impact. Yes, it will talk of Rasva and Raktava Srothas. Now, two very different things we will talk, which modern medicine may not. We will talk both of lymph and blood. Modern medicine may not. I won't say they do not. I'll only say may not, because depends. It's a physician's inference. How does he read a clinical condition? But in the Ayurvedic context, reading both Rasva and Raktava Srothas and its impacts thereafter becomes significant when you are faced with such a situation. Following a history of urine infection, there could another be a representation that I had some urine infection a few days back and then I developed this cough. Now, this is usually seen in emergencies, usually seen in ICUs, in terminal conditions where renal failure leads to a pulmonary condition and thereafter need for ventilation increases, etc., etc. But this progression, and then there are cardiac involvements, this progression from the renal system to the respiratory and involving the cardiac system, or in Ayurvedic context, Mutra to Pranava Srothas, it is of significance that what is the trajectory of flow of this medical condition, how this medical condition has progressed from one point to the other, and what was the incidence or what was the incident cause, because that helps you identify the kind of infection it is. In terms of Ayurvedic context, you can say the kind of Prakriti imbalance, was it Pitta, was it Kapha, and then its progression into an impact leading to, which means the microbial infection and following its impacts on the body's own defense mechanism working, and the resultant Vipak of the body's own digestive activities or phagocytic activities, leading to which direction it is treating a new condition or development of a new condition, a concomitant condition, and helps assess what is the progression of the disorder. Therefore, it is important to sequentialize the last point that I had taken in the last lecture, the clinical history, and thereafter map these anatomical phases or these developments across the various anatomical designs of the body. The other significant element is of discussing or talking about modern physiological reports that you get. That means modern pathological reports, the laboratory reports, and this does not talk about really the scanning reports. This is not trying to visualize the physical structures. It is rather talking about more of the physiological functions of the body. Why it is important and why it is necessary to interpret these reports, to bring them to a coherence when you talk of Ayurvedic understandings, is because when you get that, you are able to correlate it in a language against what you have inferred in your anatomical design that you have best studied as a student in school, before the medical school. Second, it is the same language in which, besides you, most medical technicians or practitioners will discuss. Third, in the internet age, if the patient wants to go back and really look at what these reports are about, what does, say, an increase in bilirubin mean, a coherence of what you tell him and what he reads on the screen to his own understanding has a very big impact, not only on the trust value that he generates, but also on the fact that he is able to find it easier to relate what is being treated and how it is being treated. Then there is a fourth element also, that even yourself, it becomes easier for you to be convinced about what you are treating for and what you tell him in a language that he understands. Reason, your primary basic schooling is modern science, modern interpretations of science. It is not Vat Pitta Kapha, it is not Sattva Rajtam, it is not Kshatijal, Pavak, Gagan Samir, Atma, Ojas, none of these. So, in a very broad outline, it is significant that you relate to these subjects, these pathological findings, and you are able to juxtapose them on your understanding of the anatomy, and you can say that the involvement of Rasva Srothas in case with a Pitta presentation is an appearance of bile in the blood stream, in the lymphatic stream. So the inferences that you draw, and when you want to discuss even in the Ayurvedic terms, they are explainable. The next lecture will look at actually juxtaposing or bringing a mirror image of modern and Ayurvedic sciences together in your clinical diagnosis, in inferring these conditions to the best of design in terms of diagnosis, and then further we will have correlations of Prakriti, etc. that develop. So In the next 3 lectures, we will look at how you can improvise yourself, how you can develop yourself when it comes to discussing clinical manifestations, to discussing the presenting symptomatology, to the patient's benefits and communicating it across. Remember, when it is telemedicine, and as I said the last time, it is a lot of effort, it's a lot of time that you need to give, but you're fortunate that the patient provides you with a lot of information that, more than being filtered, needs to be actually seen through, linked, and then found out if really there was something that was to be missed. Sometimes there are conditions of fear, sometimes there are conditions of unheard of complaints, but they just might be reflections of things linked around.